to the Gold Standard Radio Show. I'm Craig Goldenfarb, your host and the founder of Gold Law. We've been a personal injury law firm in West Palm Beach for 25 years. This is the show where we spotlight the individuals and organizations making a real impact in our communities. Those who embody excellence, integrity, compassion, and the gold standard in everything they do. Every week, we'll sit down with game changers, difference makers, and unsung heroes who are shaping the future of Palm Beach County and beyond. Whether it's through advocacy, innovation, or service, these are the people setting the bar high and showing us what it truly means to lead with purpose. So sit back, get inspired, and let's dive into the stories that define the gold standard. Good morning or good afternoon. This is Craig Goldenfarb. I'm with the Gold Standard Radio Show, and I have a wonderful guest with me today, Sheree Wolliston, who's the Vice President of Community Impact at the American Heart Association. So good morning, Sheree.
Good morning.
How are you today?
I'm doing well. How about you?
I'm doing great.
Good.
So I personally have an interest in all things heart-related. As you may recall, we've met before, and I started a charity that actually gives away free defibrillators, which are those things you see on TV that shock people back to life after they have a sudden cardiac arrest. So I have a particular interest in the American Heart Association, and that's why I formed a relationship with Sheree and her organization. So why don't you tell us about the American Heart Association and how long it's been around and what your mission is?
All right. The American Heart Association our mission is to be a relentless force for a world of longer, healthier lives. And we've been around for just over 100 years. And our main focus is really to advance science and research and make sure that we're putting the best science and research into practice in clinical and community settings around improving overall heart and brain health. And so that's our mission, to advance science and research, and then also to implement community-based strategies that are going to improve overall health outcomes.
Is this a national organization or international?
International. The American Heart Association is all over the world.
Wow.
Mm-hmm.
And do you know anything about how it was, 100 years ago, that's a long time.
Yeah.
So how was it founded, if you have any idea?
It was founded by a group of cardiologists who actually were looking at heart disease. And back when the organization was formed, heart disease and heart attacks were seen as a death sentence. You know, if you had cardiac issues, you were going to die. A group of cardiologists came together and decided that shouldn't be the norm, and really focused on raising funds to support clinical research and to support improving clinical outcomes. And then over the years, our work really developed to look at social determinants of health, look at community impact, look at how we can work both inside and outside of the clinical systems to improve health outcomes.
Wow, that's amazing. So 100 years for a medical organization, that's fantastic. Tell us about, so you work in Palm Beach County, so is your office on Australian, if I recall?
Yes.
It's actually close to my office, I think.
Yeah.
And so what does the Palm Beach County affiliate do in particular in a local nature?
Right. So our affiliate is Palm Beach and Treasure Coast. So we do impact Martin, St. Lucie, Indian River counties. We also work in our rural counties around Lake Okeechobee, so Hendry, Okeechobee, and Glades counties as well. And what that looks like is for me and my team working with other community-based organizations to really look at how they can improve the health of the residents that they're supporting. And then in the clinical spaces, we basically take the science and research that the AHA is continually funding and all of the developments that come out of that, and work with our clinical providers to put those quality improvements in place that are going to better help people control risk factors around heart disease and stroke.
How is the American Heart Association funded? Is it public or private or combination of both?
It would be a combination. We definitely rely on support from our community grants. We also rely on funding from different companies that work with us and support our cause. So it really is both public and private.
That's great. Tell me about, I think there's an event coming up, the Heart Walk in West Palm Beach.
Yeah, the Heart Walk is November 8th. The event opens up at 7:30 in the morning. We'll have a whole bunch of different activities. Shout out to my son who sings the national anthem. He's a student at Dreyfus and he's pretty awesome. And then the actual walk starts at 9, I want to say. I'm pretty sure it's 9 o'clock. And it's a 3 mile 5K, and you can either walk it, run it, Bring your dogs. We love dogs. We have a top dog contest every year. I think we still have that this year. Might have to check on that. But we love, like, it's just a great way to get friends and family. And also, if you have a company, it's a great way to get your company involved. It's a great team building activity too.
So in order to get involved, you don't have to be a company. You can just sign up for the 5K, right?
Yeah, you can just sign up, and you don't have to fundraise. A lot of people think that, like, if you join a team, you have to fundraise. Like, we appreciate everyone who does fundraise and helps us to raise money towards our mission, but it is really an event where we try to reach the masses. So we just want everyone to at least get involved, come out, learn hands-only CPR, learn about heart health, and learn how to then take that message and spread it to family and friends.
So I want to move on to you yourself. So you've been with the American Heart Association how many years, Sheree?
7 years.
And have you had the same job for 7 years?
No, I started out as a community impact director.
And what was a community impact director?
The community impact director was basically what I do now. However, as a VP, I also really look at strategy and do more collaboration with our development team in order to take the opportunities to advance the mission and really see how we can also impact our local community. So it's basically the same. It's the same work, so working in the community and working in our clinical systems, but then also as the VP, it's just more of that strategy partner with all of the different parts of our organization.
How long have you been the VP?
Ooh, I want to say four years.
Well, congratulations on the promotion,
Thank you.
4 years ago. And before the American Heart Association, what was your career path like before that?
I've always worked in government and nonprofit. Prior to this, I was the family self-sufficiency program manager for the West Palm Beach Housing Authority. After that, I worked at Planned Parenthood, where I led a teen pregnancy prevention program, and I used to work with both teens and parents on just healthy relationships and promoting personal health. And then after that, I started working at the Heart Association.
So today, as Vice President of Community Impact, what does your day look like? A lot of meetings?
A lot of meetings. Definitely a lot of meetings, a lot of strategy with both internal and external partners. We have a coalition that we lead, so really doing a lot of the work and planning and making sure that we're tracking towards our targets for that, budgeting, managing all the different budgets, because, you know, we have a bunch of different budgets from grants and then also some of the companies we work with. So I have to make sure that we're managing all of those. Sometimes I'm doing some education in the community. If we are launching an initiative, I'm doing the back end of the work there to prepare for that to launch. So every day is different, but every day is rewarding and fulfilling.
Well, it sounds like there's at least a lot of good variety in what you do.
Oh, yeah.
That sounds like my day.
Yeah.
A lot of good stuff. So you work across Palm Beach County and Glades and Hendry and out west. So, you know, there's wealth in this area of the county. There's not so much wealth out in the western parts of the county and the Lake Okeechobee areas. What are the challenges you face with the very different, diverse demographics that you deal with?
I would say every community is very different, and every community has some challenges. Every community has bright spots as well. So I would say that a challenge, I think, in both urban and rural communities is going to be pockets of poverty. You know, we know that, like, social determinants of health, they basically drive the way that people are able to not only the length of life, but also just the quality of life. So when you look at poverty as a driver, if somebody doesn't have insurance, if somebody doesn't have access to transportation, access to, you know, fulfilling jobs, those sort of things, they sometimes can either inhibit them from being able to access health services, or if you're worrying about where your next meal is coming from, a lot of times, like, you're not worried about going to the doctor and checking on yourself. You're making sure that your kids can eat. So I see that in both rural and urban communities. I would say a larger challenge in rural communities is just access and availability of services. When you have a huge geographic area and not many people there's not a lot of providers that go into those areas. So you see a healthcare shortage. You also see an issue with just access to healthy foods. And, you know, a lot of communities in our rural part of our county are reliant on corner stores. And a lot of times those stores don't necessarily have fresh fruits and vegetables for people to eat. So when we talk about like access, that's one thing I see. I will say that in rural communities, there is a huge sense of community. Like people are nicer. People are really kind to their neighbors. People care about each other a lot. And I will say that like when I do work in the Glades, that's one of the things that I absolutely love is just the people and the way that they are positioned and ready to come together to impact health. And I think it's just about providing them the access and resources in order to do that.
Well, I tell you, I found that to be true. I just opened an office out in Belle Glade, and I just got involved in the football community. The faith, family, and football is what they say out there. Is their motto. Yeah. And as soon as I became supportive of those three tenets of their organizations out there, I was like, yeah, this community is really special. It's so much less fractured, I guess. Even though they're disadvantaged in some ways, I think they're much closer in other ways. So I think that's really a good point out there.
Yeah.
So I guess if you make impact in one part of the community out west, you're probably going to have a quicker, broader spread.
That's true.
Because people talk to each other so much.
That's true.
So yeah, it's a little fractured here back on the East Coast.
Yeah, I'm part of a network. It's called the Faith Health Educators, and it was put together by Dr. Lisa Lucie from FAU College of Nursing. And I mean, like we meet every week, and it's organizations, but also like local faith leaders from the community. And it's probably my favorite meeting of the week because it's just the people. People are amazing.
Yeah, that's fantastic when people come together in support of anything, especially health. It's definitely rewarding.
Yeah.
So speaking of that, you have an initiative or a grant program called Supporting a Culture of Health. Why don't you tell us about that?
So the Supporting a Culture of Health initiative is funded by Palm Health Foundation and HCA Foundation, and it is an opportunity for us to work with local organizations and local leaders to improve health with the population that they serve. Like the AHA, we really rely on us being able to work with organizations who are providing direct services in order to really impact health because our team is so small and we can't do everything. So building this network of other organizations that are also focused on health, we're able to really improve health outcomes as a collaborative working together. And so the Culture of Health grants, we do them every year. We have a RFP that should be coming out, request for proposals, that should be coming out in November. I just need to write it. So it's coming. And usually we do up to $4,000 per grant. And the areas of focus are around tobacco, either tobacco-free site policies or tobacco cessation programs. We also do blood pressure, controlling blood pressure. And then we do cardiac emergency response, so CPR, cardiac emergency response plans, and nutrition security, so anything having to do with nutrition. And it's really about creating sustainable change, so really thinking about something that we can fund and we can work with someone to develop that is going to, even after the grant period is over, is going to change the way that they're doing things with their residents and clients that they work with.
Well, I hear that that's funded in part by HCA, so I had the president of, I think, JFK North on here, or the CEO, who's also on your board, I believe, Ken West.
Yes.
So
well, he's not on our board.
Right.
He is our executive with Heart. I think he's like our executive with Heart champion for the Heart Walk, and I'm probably butchering that because that's not my wheelhouse, but he is a leader, and we appreciate him for all that he does for the Heart Association.
Well, he was here talking about his role with both HCA and with your organization here on the radio show a while ago, so I do have to put in a plug for HCA. HCA, for those listeners who don't know, is the owner of several hospitals around here, and they take an active role in the community. So HCA is one of the funding partners you have for the Supporting a Culture of Health?
Yes.
That's just fantastic.
They're amazing, yeah.
So, speaking of coalitions, you built coalitions with so many different organizations, Palm Health, which is also a charity, HCA, and you built coalitions with hospitals, schools, nonprofits, and other corporations. I assume part of your job, Sheree, is to build those relationships.
Yes.
So tell me about how meaningful that is for you.
It's really meaningful, and I think that It's been a really great part of my career because many of the coalitions and partnerships I've been a part of in previous roles, like the relationships carry over into new roles as well. And I think that's just important when it comes to building these coalitions, is to build up those personal relationships with people, because at the end of the day, we need each other to fulfill all of our missions. So I think that when we have a shared set of goals, we have a shared understanding of what's important to each other, that's really the important part of just being able to create impact in our community.
So you're talking about peer-to-peer relationships, which is people our age or closer, or at least adults. How do you view mentorship, which is usually people younger than you? I know personally I love mentoring other attorneys, other business people. I assume, Sheree, part of what you do is also mentoring younger folks.
Yeah, I love mentorship. And I remember I was working at the Housing Authority, and there was this man named Michael Odom. If you know him, you know him. You know he's great. And one day I was sitting in my office just thinking about what was next for me. And he came in, and we started talking. And he actually made a phone call that landed me the position at Planned Parenthood in the education department. And one of the things that he told me was, whenever I get to a place where I have the opportunity to mentor others, to make sure that I do that. And I think that, going back to what he told me, and over the years, this was almost 15 years ago, and since then, mentorship has been a huge part of what I do. If someone is one of the people on my team, I try to figure out what's important to them and really try to put them in a place where they're able to, shine. Because at the end of the day, I don't want to do this forever. I feel like there's more for me, right? So it's about equipping the people on my team so that when I go, that the work continues. And that's what's really important. And I was just talking to someone in their early 30s, and, she was like, oh, I feel like I should be doing more. I should be doing this. And I'm like, you're exactly where you're supposed to be. And you're talking to people, you're doing the right things. Like, you're looking at people who are older than you and probably been doing it for longer than you, but you are, like, you're the me, and the other people that you're looking up to, like, you'll be our age and you're probably going to be ahead of us. So it's like, just keep on walking your path, I think is the most important thing. And don't look at others. Like, really do what you do best and look to people who you can learn from, and find that person who is going to, like, speak your name in places that you wouldn't normally be spoken of, and in a good way, and give you those opportunities. I think that's just really important.
I think when I hit middle-agedness, if that's a word, I found that there were a lot more people like me who wanted to mentor people in their 20s and 30s than I thought. So what advice would you give to someone in their 20s and 30s who's like, how do I find a mentor?
Well, how do you find a mentor? I would say if there's someone in the community that you look up to, find their email address, try to reach out to them, connect with them on LinkedIn. You never know. Some people will welcome a coffee date with you to just kind of have a conversation, see where they started, how they got into what they're doing. And I think that's a good one. I would also say that there are plenty of organizations that have, like, mentorship chapters. So I think of, like, the Urban League, Young Professionals, the Black Chamber, they have a Young Professionals group. United Way has a Young Professionals group. And then I have volunteered and mentored for New Leaders Council. And New Leaders Council is a national organization, and it is more like democratic leading, but it is an organization that teaches about public office, running for public office, what it's like to start a campaign, what it's like to do, fundraising, all of those different things. So it's really about leadership. And so that application is open right now, too, if you want to search, like, New Leaders Council Palm Beach.
I myself had a mentor when I was in my 20s, and I found that to be one of the most impactful relationships I ever had. And what it also led me to do is to really seek out at this age to find people I could pay it forward to. Did you have a mentor when you were younger?
I did. When I was younger, one of my professors in college was sort of like a mentor for me, and it was really funny because it started with me wearing a shirt that, like, she did not love, and she came up to me and she was like, "You are a queen, and you cannot wear that shirt." And so I looked to her because of the fact that she just, like, she just emulated this like grace to me. And I think that you don't necessarily have to have, she was someone that I had a personal relationship with, but, another mentor of mine when I was growing up was Oprah. I absolutely loved Oprah. I wrote to her. She never wrote back. But I thought that I was going to be the next Oprah. So what did that mean? That means I went into journalism. That means I started to write more. That means I started to look at ways that I could possibly have the career path that she had. It didn't turn out that way, but I think that the different things that I did to kind of learn her ways and learn about her helped me in the role that I'm in now.
That's fantastic. Well, are you in the C-suite? Are you in the C-suite at AJ as far as like
at our local level?
At a local level. So do you think C-suite leaders should also be active in the workplace wellness programs?
Yes, because at the end of the day, like C-suite leaders are setting the tone for the organization. So if you are not practicing what you're telling everybody else to do, it's hard to, change the culture of the company. And also, if wellness is important to you, then it's really important to ensure that it's baked into policies and practice in the organization. So yes, C-suite is very important.
So we all know the things, eat right, sleep well, exercise, everybody's got those challenges. But there's also blood pressure management, nutrition security, CPR training. I mean, these are some of the lesser spoken aspects of heart health. So why don't you talk about those lesser popular parts of heart health, blood pressure management, nutrition security, and even CPR training?
Yeah, blood pressure management is super important because a lot of times we call high blood pressure the silent killer. So if you have high blood pressure, if it's chronically high, many times you don't really know that you have an issue if you're not going to the doctor until, unfortunately, you have a cardiac event. And whether that is a heart attack, sudden cardiac arrest, it can lead to strokes, all of those different things. So it's really important to manage blood pressure. Only way to manage it and know your numbers is to go into the doctor. And you can go to, there are locations within the community that we've set up so that you can measure your blood pressure on site. However, even if it is high, you can't be diagnosed and you can't be treated without the support of a provider. So really want to make sure that we are getting those annual checkups. When it comes to CPR, when people have cardiac events, most times it's happening outside of a clinical system. So if people aren't having sudden cardiac arrest in hospitals, they're having it in homes, schools, and workplaces. So it's really important that individuals know hands-only CPR at least. And it's really simple to learn, and people don't realize how important those first minutes and seconds after a cardiac event are for people to, get that life-saving support. A lot of times people will wait until first responders come, but minutes equal loss of brain health and brain tissue, right? So it's really important for people to learn CPR so that they can act as first responders until the first responders get there. And whenever, I will say this, that even though many people who suffer cardiac arrest outside of the hospital system or in the community don't survive, my husband suffered from one and he did not survive, but anytime someone does survive, hands-only CPR is always a part of that story. So it's really important that people know how to perform CPR and do that until first responders arrive.
And for free training on CPR, I know there's lots of resources available, but one of them is the Heart Walk on November 8th. Is that right? So you can come out on November 8th, and is it the Meyer Amphitheater again?
Meyer Amphitheater, yeah.
So come out on November 8th and learn about CPR. So you don't have to be afraid of the old mouth-to-mouth thing. Right. It's hands-only CPR that you can learn out there and definitely save a life. And so what is one big myth about heart disease or wellness that you think there might be out there?
I think that one thing that is a myth is that, our genes predetermine everything. I actually, my doctor told me that our genes might load the gun, but our habits pull the trigger. So what that means is that if you have, it's important to know your family history. If you have heart disease in your family history, if you've had, multiple people in your family who have had strokes and have high blood pressure that runs in your family, a lot of times, yes, there could be genetic predisposition there, and it's something that we need to think about and watch, but it could also be traditions that are passed on through our family as well. It could be our habits that we do every single day. So I think that, one thing that we need to think about is, yes, everybody is going to die one day, but we want to die when we're older, after we've watched all of our family, thrive and flourish, and we want to have healthy years in our older age. So we want to make sure that we're doing all of the things to improve and make sure that that's possible.
So just thank you so much for your time today. If there's one thing we could do to have people get involved with the American Heart Association, what would that be?
You can log on to the website. It's heart.org. There's so much information there. If you ever want to learn more about us, there is a tab that says in your community, type in your zip code, and it'll pull up our local page for Palm Beach County. And I would say definitely come out to the Heart Walk. It's on November 8th. We start at 7:30, so come out bright and early if you're a kid looking for some volunteer hours, really looking for like older teens, so like maybe juniors, seniors, and definitely college students. Come on out, you'll get volunteer hours, but just log on to heart.org and you'll be able to get more information about the Heart Walk as well. That's it.
Wonderful. Sheree, thank you for sharing so much about your wonderful organization that's been around 100 years, the American Heart Association. This is Craig Goldenfarb. I am with the Gold Standard Radio Show, and it's been an honor for me to have Sheree Wolliston, the Vice President of Community Impact of the American Heart Association, with us today. So thank you so much again for your time.
Thank you. I appreciate it.
That's a wrap on another episode of the Gold Standard Radio Show. A huge thank you to our guests for sharing their incredible journey and for being a true beacon of excellence in our community. At Gold Law, we believe that when we lift others up, we all rise together. If you know someone in our community making a difference, someone who lives and breathes the gold standard, we want to hear about them. So please reach out, connect with us on social media, and let's continue celebrating the people who are shaping a brighter, stronger future for all of us in Palm Beach County. Until next time, I'm Craig Goldenfarb. So stay inspired, stay committed, and keep raising the gold standard.
Every day, 1,500 children in Palm Beach County wake up in foster care through no fault of their own. They have been torn from everything they know, facing fear, uncertainty, and unimaginable hardships. Many have suffered neglect, abandonment, or abuse, and now they must navigate a complex system that often falls short of meeting their needs. But they're not alone. That's where Speak Up for Kids steps in. We provide life-changing advocacy, life skills training, and essential resources to help these children heal, grow, and thrive. From educational support to everyday necessities, we bridge the gaps so they can have a future filled with possibilities. But we cannot do it alone. These children need champions, someone to stand in their corner, fight with them, and remind them they are valued and not forgotten. Will you be that champion? Visit www.speakupforkidspbc.org today and take action. Your support, whether through donating, volunteering, or simply sharing our mission, makes all the difference. Together, we can bring hope, stability, and a future to children who need it most. Don't wait. Take action now. Visit www.speakupforkidspbc.org and be the hero they deserve.